Now, to the issue of vaccines. Australia has secured an additional 10 million Pfizer doses. We've been able to contract securing those vaccines. That brings to now 150 million doses, what Australia has been able to secure to not only vaccinate Australia, but to ensure that we're doing our bit in this part of the world. Yesterday I joined the Pacific Island Leaders Forum, and we're able to give the good report of how we're working with them, together with the United States and France across the Pacific. And this, as much potentially assists that task as it certainly assists our task in the rollout of our vaccine. These additional vaccines have been secured consistent with our requirements under the strategy. And I want to commend again Minister Hunt and Professor Murphy for the great job they and their teams have done in continuing to fulfil our commitments when it comes to delivering this vaccine in Australia. It is the big agenda item for us, obviously, because it provides the pathway to so many of the other things we wish to achieve this year. They can speak more to the details of that. We are still, though, on track to commence later this month. That puts us in a very good position, particularly with our sovereign vaccine production capability, ahead of many countries like New Zealand, for example, we understand won't commence until April, I think it is. And we're working with them as well. And I had a good discussion with Prime Minister Ardern on that just the other day. But Greg.
Thanks very much to the Prime Minister and Professor Murphy. We know that the pandemic continues to rage around the world. Fortunately, we have seen some reduction in global numbers in recent weeks, or in terms of the daily cases, but sadly the number of lives lost continues. In Australia, one community case today on the advice that we have from the National Incident Centre, obviously within Victoria, and no lives lost. No lives lost in January against a global figure of approximately 400,000. And those figures put into perspective the situation in Australia. Safe at home, but challenges abroad. And against that background, the vaccine rollout is the next critical step in protecting Australians. As part of that vaccine strategy, we have followed the advice on purchasing from the Scientific and Technical Advisory Group, or SciTag, led by Professor Brendan Murphy. They provide the advice and we implement. As part of that, they advised from the outset that we should build an option subject to the determination by the TGA into our contract to purchase additional doses if the TGA were to approve the use of Pfizer, because it's an mRNA vaccine, because the world has never had an mRNA vaccine. And we did that. We did that quietly, behind the scenes, and once the TGA approved the Pfizer vaccine, we triggered that option, and I am pleased to be able to announce that Australia has purchased an additional 10 million doses of Pfizer. That is the advice that was provided to us by Professor Murphy's Vaccines Committee, and it's been implemented in full. That's important for Australia. It provides additional support over and above that which was already in place. As the Prime Minister said, a total of 150 million vaccines, 20 million Pfizer, 53.8 million Oxford AstraZeneca, where we've seen some very positive results, which Professor Murphy will take you through from around the world. 51 million Novavax, again, positive results in recent days. The strategy in terms of the choice of vaccines set by the Vaccines Advisory Committee is proving to be very valuable and well informed. And then, of course, 25.5 million units under the COVAX International Facility. All of those things are coming together. Shortly before joining you, I spoke with both AstraZeneca Australia and Pfizer Australia, and both have reconfirmed that at this point in time, the vaccine rollout remains on track, respectively for the last week of February for Pfizer and the first week of March for AstraZeneca, subject to the TGA in terms of AstraZeneca, subject to shipping in both cases, but both have reaffirmed their guidance only within the last 2 hours. So I think that's very important. Finally, there are two other elements that I want to highlight. Uptake of the vaccine is very important, and the more Australians we have vaccinated, the better. In particular, we want to work with cultural and linguistically diverse communities, and we will accordingly be allocating $1.3 million for additional funding to multicultural peak bodies to assist in information to culturally and linguistically diverse communities to support the vaccine rollout. That will include advertising into 32 languages, a vaccine explainer in 29 languages, campaign builds on 63 languages on the Department of Health's website. That's very important. But the last element which we considered is that we need to make sure that everybody who's on Australian soil is safe, and everybody who's on Australian soil has access to protection. So on the advice of the medical experts, the government has determined that we will offer vaccines to all people living in Australia to achieve the maximum level of coverage. That means the government will provide COVID-19 vaccinations free to all visa holders in Australia. And this will include refugees, asylum seekers, temporary protection visa holders, and those on bridging visas. People currently residing in detention facilities will also be eligible, including those whose visas have been cancelled. So that's making sure that there is the maximum possible coverage in Australia. And today is another important step in the vaccine rollout and in building on that work that Australians have done of keeping each other safe. They've done an amazing job, but the vaccine rollout is what will help us in a world of enormous numbers of global cases and, sadly, lives lost.